to our first conversation for today, and the focus is on mental health, specifically adolescent mental health. And we have with us three representatives who are going to be talking about some great work. They're starting off today. It's being coordinated by UNICEF, so we're joined by UNICEF Belize representative, Dr. Susan Kasedde. In the middle, we have Liliana Carvajal, who is from UNICEF headquarters in New York. And on the end, we have Juliet Simmons, who is from the Mental Health Unit at the Ministry of Health. Good morning and welcome.
Good morning. Thank you.
So you are initiating a very intensive 4 days. And I want to start off by just finding out, Kevin was asking you off camera, but I also think it's important. It seems to be so timely with what is the prominent issue in news right now. When did you first decide that this was a focus that was necessary?
Well, thank you again for having us. And this work is being led by the Ministry of Health, by the government of Belize, and UNICEF is supporting that work. The work on mental health, when I arrived in Belize in 2017, within the first 2 weeks of my arrival, I remember sitting with CEO Figueroa from the Ministry of Health. And he said, you know what, Doc, we've got to do something about mental health. So in effect, the ministry has been thinking about this for a long time and working on this for a long time under extremely constrained resources, and Juliet will give us more details about that. But what we know now is that mental health has a significant toll on our well-being overall. Mental health is something that we all live with. Everybody has to deal with certain effects of poor mental health on a daily basis, from low-level anxiety all the way to issues requiring more complex care and treatment. And the challenge with adolescents, we're recognizing as UNICEF, is that this is an area that is extremely underattended. The WHO estimates that about 264 million people are dealing with depression, are living with depression and anxiety and the complications that arise from that. The majority of these are undetected, untreated. In adolescence, we know that mental health challenges usually start by the age of 14, again, mostly undetected, untreated, and the effect of that is that it continues into adult years with significant effects on emotional well-being, on physical well-being, on mental health, that continue into adulthood and have effects on productivity. The workplace is not spared from the effects of mental health that started in adolescence. The global economy, I think, loses about $1 trillion out of lost productivity because of untreated or because of poor mental health. So we've known for a long time globally, just looking at the numbers, institutionally, looking at the effects on adolescents, but also certainly the government of Belize has known for a long time that this is an issue that needs to be addressed. So we've been planning this and working together for a while. And this week is an opportunity for us to actually transition that dialogue into national action on measurement, which we'll be talking about, and design of approaches to strengthening intervention.
So you guys are measuring right now, setting up a framework to actually measure, so that I guess you can say definitively how it economically affects us, what percent of the population. But what is the overall approach to measuring? How are we going to measure?
Thank you for that question. So we're very excited to be working in Belize. Belize is truly a pioneer in these efforts. The idea to measure mental health, our approach is to measure it at the population level. It's speaking to the adolescents in their homes, in their households, because we have some information coming from health information systems from the countries that has been captured, and it's a very important set of information. However, that information is only giving us insights into the adolescents that have actually approached health systems, and we know that's a limited proportion. So we want to go beyond that. We want to hear from adolescents who are outside of school, who are in school, who are not necessarily approaching health systems, to tell us about their mental health conditions. So we're looking into measuring three main aspects that are very important and are overlapping, and are depression, anxiety, suicidality, and how these aspects of mental health can have consequences, as Susan mentioned, in their potential to live to fulfill their full potential at school, at work, in the family settings, in their social settings. So this week is very exciting because we are going to start speaking with adolescents from Belize, from the 10 to 19 years of age. We're speaking in two groups. to hear from them. How do you see these? How do they interpret these?
What mechanism will you use to get to those people who are in between institutions, who are not in school, who are not probably working? Is it going to be a house-to-house survey? What is the approach, the specific mechanism?
Well, right now, I guess I want to say what we're doing is we're pretty much testing our instruments. We're not going out into the population just yet. So we just have a group of adolescents we're meeting with this week. So I think we're meeting with about 30 of them this week. And then we meet again in July and August to further it out, to broaden it out a little bit more. And then next year, we roll it out to the population.
So you're perfecting your tool,
Right.
your measurement tool.
Right. And the idea for this week specifically, we worked with a number of schools, but also with a number of community-based organizations. So we identify a diverse range of adolescents in school and out of school, as Liliana has mentioned, so that we get the perspectives from a range of adolescents.
Are you including children from institutions?
We have some from Colby, I think. No.
Yeah. Institution, yes.
So like Wagner's or even some
Right,
of the
right,
homes.
right.
Yeah. Okay. Now, before we get there, though, I really wanted to ask, because in understanding this is perhaps a priority area, it's necessary for us to understand what the current landscape is. And 10 to 19, I was saying before, is pretty much from upper school, Center 4, maybe up to tertiary level for some students. We know to a certain extent that high schools have been getting on board with getting a school counselor at least. Not all, but some. And they're pretty stretched there. We had a conversation with them separately. But the primary school area still seems to be a gap. And I wanted to ask you, Juliet, just what is available for children of this age range currently?
Unfortunately, not much. The Ministry of Education has counselors. They have a whole unit that provides some level of counseling for the primary school level in the districts, but it's like 1 or 2 counselors.
For all the schools?
Right. So that's at the Ministry of Education level.
Yeah.
Then the church state schools also have counselors for their schools, but then again, it's like 1 or 2 counselors for all of their, like, you know, in Belize City, let's say the Anglican diocese would have maybe 2 counselors for all the Anglican primary schools. So it's, again, not very available to them.
Yeah. And then the school counselors, I understand. What's the level of training they have? Because we had a team of counselors here who spoke of having to manage classrooms and have the responsibility of being a counselor.
In Belize, the school counseling profession is quite unique, that they do both counseling and teaching. They have to manage a teaching load as well. It hasn't been separated just yet. Unfortunately, I said that.
Yeah.
But I guess what is expected of school counselors is just basic. They're not expected to do, heavy mental health type of counseling.
Yeah.
Those would have to be referred out.
Yeah. So the reason I ask that is because what you've pointed out before is that there's a manifestation sometimes of perhaps a mental illness within that specific age, which perhaps has been going undiagnosed for a very long time in this country. What is your primary concern in knowing that perhaps we have young adults or maybe middle-aged adults who are walking around with an undiagnosed illness that perhaps can be treated for a better quality of life?
So what we're trying to see first of all is that we strengthen the prevention of the onset of more complicated mental health challenges by making sure that there is early support. And so the discussions that we're having with the team that's visiting from New York and that's working with us, with the government, is how can we, knowing the resources that we have available, the limited specialized resources that we have, but also knowing where the children are. They're living in homes, they're living in communities, they're interfacing with schools, fortunately, for the most part at an early age. How can we make sure that they have information available to deal with some of the more prevalent challenges like mild anxiety? Because a child who is anxious would benefit from knowing that anxiety is ordinary and would benefit from certain support to strengthen their resilience, and their ability to cope, their ability to handle relationships. So these things that are ordinary adolescent challenges, can be addressed if there is better information, better guidance, better support from teachers, from people who are closer to the child if we have deliberate approaches for interacting with parents, for interacting with teachers and counselors and others available to that child to make sure that they can provide that support. But also if we can leverage, for example, technology to make sure that we're meeting children where they are, providing them with the basic information to understand some of the complex things that they're experiencing and thinking through their interactions. So that's the critical starting point, prevention, so that those limited specialized resources that we have, those trained, highly skilled resources that we have, can be freed up to deal with the more complicated cases of mental health and not be overburdened by, the lack of preventive effort earlier on.
What I wanted to add to that is that we have plans to incorporate a mental health literacy program within the schools. So we've done some training. We started that in December last year. So we trained a bunch of school counselors and some principals and some teachers were there. So they have an idea on mental health literacy, and it's exactly what Susan was just explaining, to have an idea of what these things are, how to express these feelings, and what to do about these feelings, and not to feel weird and all these things. So all of that would be incorporated in the life skills courses, and life skills classes are now in primary and in high school. So we have, the Ministry of Education has worked on the curriculum to include this, to include more of the life skill classes, more time, more hours in there in the week.
Go ahead.
This is a huge problem globally. You're talking about 1 in 5 adolescents are experiencing some sort of mental health challenge. But I wanted to get into the risk factors. Why is this age range at such risk?
Yeah. I think at some level it's also part of the stage of life that adolescents are at. An adolescent brain is a brain in transition. It's a brain that is questioning. It is a brain that is questioning around identity, around belonging. And if you think about the experiences of an adolescent, it can, for many adolescents, be isolating. They are subject to incredible spike in stress, whether from academic pressure, but especially too from social pressure, whether it's from the parents and expectations for performance in schools and society, or whether it is pressure from conforming to what their peer group expects, or from what the media says they should look like, how they should behave, what they should have. And so there are incredible stresses on a brain in transition. And this is a vulnerable brain, yet a resilient brain. And so without the support to enhance the resilience and diminish the effect of that vulnerability, you have a brain that is on a collision course for some of the effects that, of the exposures that child is exposed to. So that's why for us, we try to make sure that information is available. We really need to make sure information is available. We need to make sure that support is available from every avenue that can be mobilized for that adolescent. The family environment is a key source of exposure to stress. The school environment is a key source of exposure to stress. The peer group. So information and engagement with these different parts of the environment are critical. Exercise, diet, and then chronic exposure to other stressors like violence. These are issues that add on to the pressure of that young, evolving mind with limited coping skills.
I'm glad you brought that up, because perhaps that's been my one nagging thought since we started this conversation. Just how do we fit in the context of the trauma that our children are exposed to, and especially because we're based in Belize City, it's more of our reality here, where children are just growing up in a setting where, I can never forget one child saying, listen, I lock up in my house from 5 p.m. because after that there may be gunshots and I may be harmed. And we already know if we hear it, we get under the bed. And that's just one story, but a reality of a child in this country. So mental health is important, and some of the predominant indicators, if you're looking at anxiety and depression and suicidal tendencies. But then even an average, quote unquote, child, if I can use that terminology, would be impacted by that kind of fear. Isn't that the case?
And that's a very good point, exactly. And that's just an example of how we all have a role to play. Mental health has usually been seen as something that requires medicalization, a medicalization approach. And it's not the case necessarily, only on extreme cases. But then as growing up, one of the biggest risk factors for kids is actually neglect, right? Not having enough attention from her parents. And when they are exposed to like risk factors like violence, if they don't have enough support in their in their network, they're going to just feel more vulnerable and more fragile, and that's when these issues like depression and anxiety may peak. So we all have a role to play in supporting our youth, the school counselors, the parents, the aunties, the friends, to really create a safe environment as they grow up. And Susan was talking about the brain, so that evolving, that brain transition. So recent research has shown that adolescents' brain is more willing, to take actions and to take risks, and to be influenced by peers. So when you put that in the mix of being exposed to these, risk factors, being more willing to take risk, and being more willing to be influenced by others, it really creates an explosive combination. So that's why it's so great to count with the support of the school counselors, with the adults in their network. And Juliet was talking about factors related to stigma. Stigma is a big element here, right? People don't want to talk about mental health. They're going to think that I'm crazy or whatever. Mental health is something that Susan said that we all go through. We all sometimes feel depressed, sometimes feel anxious, but then if we're not willing to come out with that, to speak up about that, it's going to just grow bigger in our, in ourselves. So it's very important to be able to express this, no matter how aged you are, no matter if you are 10, 19, or even as adults. We need to talk about that and normalize mental health, because it's part of our well-being.
As I sit here, there's a cultural dimension to this, because I can remember sitting with my grandmother when she was well, and she refused to watch Oprah because she said that everything was a disorder. If you white paper affected you, then you had white order
disorder.
And her approach to it was, listen, toughen up. We're powdering our kids too much, and that's why we're seeing all these things. When they were growing up, they didn't have all of these mechanisms, all of these names for everything that they're going through. How do you approach that aspect of it to say, as you were saying, this is a natural part of growing up? Just toughen up, get through it. I got through it.
We had an interesting discussion just before coming on the set. I'm an epidemiologist, and in 1990 there was no HIV epidemic in South Africa. That's what the data told us. 4 years from 1990, with the fall of the apartheid regime, surveillance across South Africa changed, and measurement was broadened. Populations that had been excluded from the measurement were included, and lo and behold, we were faced with the worst HIV epidemic that the globe had ever known. That epidemic didn't grow in 4 years. The measurement changed. Wow. So with mental health and issues like HIV and mental health, which are highly stigmatized, around which there is extreme difficulty for a family, let alone an individual or a child, to come out and say, I think I'm struggling with this, we've got to ask the question, are we asking the right questions? Are we measuring the right thing and doing it the right way? Because more likely than not, our experience tells us, the people that we know in our immediate families and in our communities, those experiences tell us that there is an issue. So we've got to measure it. And so the work that we're doing with the Ministry of Health to really ensure that we're not blinded by the veils that we have cast over the issue, so that we can see what the issue is and respond to it, this is really critical.
But I guess the concern from that population group is not that there is not an issue. The question is whether or not it's a natural part of growing up. And we're just putting more emphasis on it when we probably could better put our attention elsewhere. It's not that we don't have an issue. I think everybody would agree that all adolescents do have an issue, but that this is a natural part of growing up. This is what you go through. It's puberty is going on. You're in a social context. Your brain is challenging these things. Is it just a natural?
How do you differentiate?
Differentiate, yes.
I think that's a good point. We all go through like blue days. Some days we feel sad, feel anxious, feel nervous.
Blue days?
Blue, I don't know, like feeling blue. Yeah. However, when that interferes with your ability to get up in the morning and go to work, to your ability to complete your tasks, to your ability to interact, then that's when it becomes an issue that needs attention, that needs support, right? It's not that there's nothing wrong in feeling sad some days. It's part of life. You feel sad, you feel happy, it's normal. You feel nervous before you have a test. But when that interferes really with you really being able to complete your tasks, to have friends, you start feeling isolated, not communicating the way you used to, then you need support, because then that becomes an issue, a biological issue that really needs attention. So the idea, the approach now is to try to interfere before, to have prevention, as I mentioned, prevention and promotion mechanisms that help break into the stigma to normalize the situation, and the literacy in schools program is very important because they are going to have an open conversation in a safe place about mental health. What it is, what is depressed, what is feel depressing and or anxious, and what to do about that.
And what's normal and what you need to perhaps get help with.
And then when somebody needs medical attention, then it's normal. We all need it when we're sick with other things.
There was a really interesting series on the U.S. National Public Radio, NPR, on mental health a few years ago, and they highlighted experiences of teenagers with mental health. And what was really pointed in one of the cases that they profiled, a student, 14 years old, who had been doing really well in school. And who suddenly, from one term to the next, plummeted from the top to close to the bottom in terms of performance. Who isolated herself and became withdrawn and uncommunicative. She faced disciplinary measures. She just faced the normal measures that were put in place to correct kids, and she was, chalked down to she's going through an adolescent phase. This child had just experienced something extremely significant in the home. It was a case of sexual violence, and it was unattended. And she said, when asked eventually, to explain how she got through it, she said, "Nobody ever asked me what has happened." And so asking the right questions at the right time often gives us the ability to identify those kids who are experiencing more than what is an average stress in life. They're experiencing something that needs intervention, needs special support. The family is the first point of call. You will detect those changes in that child. The teachers who spend their days with the child will see those changes and have the opportunity multiple times through the day, throughout the year, to ask that simple question, is everything okay? And that's what I think this discussion is about.
Now, I'm looking forward to the day when we have the information available, especially in a local context, to be able to understand what our young people are going through. We can only rely on global statistics and perhaps US statistics at this point, where they are seeing more anxiety in younger children, depression in younger children. There's been studies that link early technology use to building anxiety, even social media and the addiction there. So, if one were to assume, we will probably see some of that in this country when you've completed your measurement or your baseline study. My question is, what do you do responsibly in being able to recognize a problem, but we have such limited resources to be able to address that?
That's the big question everybody has been asking. But we need these numbers. We need to know the situation. We need that baseline, like you're saying, so that we could build a case to have the resources we need. We need to know what's happening to our adolescents. We need to know. We know that mental health starts early. It starts in the adolescent years, and it continues into adulthood and into the later years. So if we know the situation for these years, for these group of people, we could prevent further mental health conditions in their adult life, so that they could be more productive, can be more effective, can produce better for this country.
One of the things that we're doing this week, in addition to looking at the question of how to measure mental health at the population level, is to look at the design of interventions to respond. So we have 2 studies that UNICEF and the Ministry of Health are launching at the same time. And one of them is entitled Helping Adolescents Thrive. And we're working with, as part of a multi-country effort, to design interventions based on feedback from adolescents themselves. We're going to be asking adolescents, what would have helped them, or what do they think would help them if faced with particular situations, so that we can get an understanding, as Juliet was saying, from them about what makes the most sense for them today in their current context. And so that's, I think, a really important step moving forward. We know we have limited resources, and the obligation that we have is to make sure that the limited resources we have are being utilized in the most effective way to respond to the needs of the clients that that we intend to impact.
Can you put a
You wanted to add something?
sorry.
Sorry, thank you. Something very exciting about this work actually is that we're working directly with adolescents. This week we're going to have adolescents in the room, and it's not us deciding what matters, how you ask the questions, what's the right question to ask. we're going to ask them, tell us. I mean, we're coming with like instruments and tools that have been developed by the experts in the US, as you mentioned, but that doesn't necessarily speak to adolescents here, right? So we want them to tell us, like, does this make sense? How would you call this? How would you like to answer this question? So that we hear from them directly, and when it comes to collecting that data, it's something that really relates to them, not to the researchers in the US, Canada, or Australia, who have made amazing contributions, but then the work is now to adapt it to the people, to our target, population. So that's very exciting.
Yeah.
Can I go back to your point that you're making, which is that we have limited resources, and I think that's a very polite way of addressing a fundamentally difficult policy distribution issue. When you're looking at their national budget, April 1st, health as an entire ministry will get maybe 2% of the entire budget,
I'm not sure.
and then mental health, which is a subsidiary of the health department. I mean, we're having issues with financial issues with morgues, with hospitals. I mean, we need supplies. And that is just for health. Now, mental health is like the ugly stepchild. That's the way it's treated. Outside child, the bastardized child. How do we get, practically, we can measure, we can say, listen, we need 50,000 jobs. But if the money is being put to creating those jobs aren't there, then we're really just going through an exercise of fantasy. So my question is, in addition to measuring, because the next step on top of the measuring is to say, listen, we need these things, these intervention systems or whatever. Do you think that the political will is there to increase the budget for mental health? To say this is a real issue, we're losing $5 million in this, or how do we get them to spend the money for something that's important?
I'll say three things to that. Number one, we have to get more money allocated towards the priority of health, period. We have to do that. To do that, the second point is we have to make the case for it. We have to have enough local data to be able to influence the wise investment of the resources that are available. The third point is health is created not just within a clinic, a health facility, or the health sector. Health is the result of investments across the board on the human lives of all of us, on our lives. And so the education sector has to invest more in counselors, has to in its own human resources to support those children. You know, we have to address violence. Violence is not created in a health facility, it's in the community. We have to make sure that we're investing more in early childhood development, in parenting, in a whole host of other areas. And so we need to take stock of the investment in our people and their well-being, because it's that, the quality of that investment, that ultimately creates health, including mental health.
That might be a pitch against getting more money for mental health, because you're saying
it's about smarter investment.
In
it's about smarter investment in people.
In prioritizing scholarships, I mean, do we have any pediatric focused psychologists or psychiatrists in country? I mean, you're talking about a very delicate age.
Yes, we do have scholarship for psychiatry.
Okay.
We do have, I think, 3 Belizeans out right now currently studying general psychiatry right now. In country, we have 1 child psychologist, child and adolescent psychologist, who practice out of the Kyle district, so Bamapan and San Ignacio.
Who's that?
That is one of our Cuban colleagues working with us.
What's the name?
It's one of our Cuban colleagues.
Yes, what's the name of the Cuban colleague?
Oh, Dr. Marin, or Doctora. Vera. Yes, so she's out there.
So the training is necessary too, and those don't come from a health budget. That can come from an education budget as well.
But I want to add that the ministry has done some work. We have come some ways, and we still have more ways to go. There was a time mental health wasn't it's now a bigger concern for the Ministry of Health.
Now people access the PMPs at clinics.
Exactly.
Now I have to include the current situation to bring it to what you're going to start today. The recent incident between 2 mentally ill persons that resulted in a death, and the unfortunate stabbing of Nurse Eligio in her work as a PMP at a clinic. I think has stirred the national conscience about what we're doing with mentally ill persons in this country. My question is, these types of conversations can very easily lead to propagating the stigma that you've been fighting against for so long. In other words, we hear people starting to say institutionalize again, force medication, where we've kind of moved away from that approach based on human rights. So when you start a conversation with the adolescents today, how are you going to tackle what is the biggest elephant in the room, and that is the stigma? Nobody wants to feel, you know, we still call people crazy if they're seeing a therapist or psychologist or going to the school counselor. How do you tackle the stigma first?
You know, it's. I think that it may sound overly simplistic, but we talk about it.
Yeah.
Because I think there is nothing more enabling of stigma than silence. No revolution in the history of mankind has been ushered in through silence. It's been, you know, courageous voices, often of those who are most affected by the worst forms of discrimination and exclusion, that have stepped forward and shown a face to the experiences that they've suffered in silence, that have helped to break open the space for dialogue, and have, you know, brought in the changes that we all now really enjoy. Credit to them. So the same with mental health. We have to talk about it. We have to provide through all of our platforms the opportunity for people affected by it, including ourselves, to share our stories and to talk about what's made a difference for us. Talking with teenagers this week about what makes a difference for them. These are critical baby steps towards what I think is absolutely essential, which is breaking the silence and allowing everybody to find a space in that marketplace for conversation to change the way that we perceive mental health, acknowledging it is a part of our lives, every one of us.
Apart from quality of life, though, after we've done the measurement, and let's say in an ideal Belize, perfect time, we somehow managed to have an impact on mental health in the country for an improvement of maybe, let's say 50%. It's an ideal world, my imagination. Where would be the biggest impact if we were to get to that level of health, mental health? Where would it be? Economically, social, where would it be? So that maybe I can sell the pitch that we need to do it.
The impact, in my view, and what research has shown, is that it's across the board. It's not only academically, it's also in the labor force, it's in the well-being of families, in the level of happiness in the population, because then less and less, if we achieve that ideal level of, you know, improvement, less and less adolescents and young people will be outside of the systems because of their own and being able to fulfill their own potential, being able to finish school, being able to join the labor force, being able to have fulfilling relationships. So I think the impulse at a society level is across the board. It's not just like academic and the rest doesn't matter. It's all across. So we all benefit from that. And so if it's my child, yes, I'm happy that my child is doing better, but then the society is also better off because kids are doing better and being more productive and better citizenships as they are able to fulfill their potential.
And coping better.
Coping better.
Do you think that Belize is in a place where we're able to accept maybe radical changes in the way that we look not only at mental health but our institutions and how it affects mental health? There's a very nice movie, it's a documentary by Michael Moore, which is Where Do I Invade Next? And one of the things he does, he goes to different countries, and one of the countries he went to, he says the students were very happy and very relaxed. They had no homework. In another country, you know, they gave them an entire month extra pay. I mean, my thing is political will. Do we have the political will to make radical changes? If we realize that the PSC, the BNSC, whatever, PSC is an anxiety trigger and these standardized tests aren't working, are we in the place where we are willing to make radical changes? Because these are not things that you can say, okay, we're going to over 20 years if it's affecting us that badly. No, or even in the prisons, maybe even conjugal visits, whatever it is that affects our mental health. Are we willing as a nation and as a society to make radical changes? to improve mental health in this country?
I don't want to think we're there. No, I think we're more of the subtle changes, not the radical changes.
So that's what you're hoping to get from the data.
Yeah, and can I weigh in on that? Because I think, Kevin, I hear you, and political will is a really important element of it. But I think we are in a phase as a society where the capital that comes from social will is showing itself, its value. You know, because we know that there is a limit to what can be delivered simply through politics. We know that there is enormous leverage and responsibility in the masses, the social masses. The change has to come too from we the people, you know, and how we engage, how we speak and stand up for the things that matter. And that's not a political pronunciation, it's a question to us.
So let's just get some of the details. You start today working with the group of adolescents, kind of like your pilot group that you're testing your tool on, and Belizeanizing it as well. And you said the rollout of the actual tool will be next year.
Yes, we partner with SIB, Statistical Institute of Belize, when they're doing the census, so we partner with them.
Okay, so it'll be tagged into the census.
Right.
Oh wow, so that's a lot of data that'll be coming.
Yeah, it's very exciting. It's a big deal for us.
Yeah. And what are the key indicators that you're hoping to get out?
Liliana?
You want to go?
Yeah, sure. The key indicators we're hoping to get out are the levels of mental health issues like depression, anxiety, suicidal behavior, and functional impairment. As I said, the extent to which these three issues are affecting our youth to live normal, fulfilling lives. So that's what we are trying to get. At the moment, there is some information about that at the global level that is coming from Australia, United States, Western European countries, and that information has been extrapolated to give a sense of how it looks in terms of the rest of the world. But we know it's not really so precise. It's a good attempt. It's very useful information, but we don't have that information in low and middle income countries. Yeah. So that it's going to be a huge gain. Another aspect of this information is that it's going to allow us to see within the country what is the prevalence of these issues in the different parts of the country, in the north, in the south, in Cayo, in Sand Creek, like how are the levels different from the different parts of the country, and also across different levels of education, across different levels of wealth. So we're going to have really insightful information that are going to allow us, hopefully allow the countries to plan better for resource allocation, is the idea.
All right. Okay. Well, best of luck as you guys start off today. I'm sure it's going to be an intensive, but also very interesting next couple of days.
Thank you very much.
Right. We're going to go ahead and take a break, and when we come back, we'll be talking to the new leadership of the Public Service Union. So stay tuned.